Hello, thank you for attending the Oscar Safety Event Training. This training will focus primarily on accessing Oscar and using Oscar from within Epic. Oscar is Baptist's new tool for reporting, documenting, and managing patient, non-patient, visitor, and employee safety events, along with managing the information required to support hospital accreditation and regulatory reporting. When an event occurs, there's the O in Oscar, that affects the safety, and there's the S in Oscar, of those entrusted to us, we must ensure we properly record the event and manage it in an effective manner. Some of those events may result in a liability claim, there's the C in Oscar, from a patient or a workers' compensation event from an employee. Ensuring the best handling of these events helps Baptist better prepare for and manage hospital accreditation, there's the A in Oscar, while providing information that supports regulatory, there's the R in Oscar, requirements such as OSHA reporting and others. There are three ways to start Oscar. My Baptist, a banner ad will show on all My Baptist pages, or from Go Baptist, an Oscar link will appear. Today we're going to look at Epic. How do we start Oscar from Epic and enter a patient event? While you are in the patient record under the Summary tab, you have access to a pull-down arrow over here on the right-hand side. Select that pull-down arrow and choose Oscar from the menu. You'll then be presented a list of choices for Oscar, and you select Oscar. Once you select Oscar, you'll be presented with a panel that allows you to select either an initial patient safety event, if a patient is involved or has been impacted, or a patient relations event. You'll use that when you have a compliment, grievance, or complaint from a patient or somebody that is with a patient at the time. When you select the patient safety event, then the event will be created with pre-filled patient data. During the filling out of the form, you will have one of the selections that asks who is the patient involved. When you've come in through Epic and selected the initial patient safety event, this information, the MRN number and the visit ID, will be pre-filled for you. The patient demographics will also be associated with the event and will be visible to the reviewing managers. If you are entering a patient relations event, you may have to select the patient. If you do, click the Select Patient button and enter the MRN number. Remember, the MRN number needs to start with 1C and then the numbers behind that. You'll also be able to search on Visit ID. Once you are in Oscar and in the patient safety event report, you'll be answering questions in several different sections. Some of those questions will be required and will be indicated by a red required next to them. As you answer questions, some questions will have follow-up questions that need to be answered. There'll be guided questioning. So for example, at the beginning of the patient safety event form, there's a question that says who reported the event or unsafe condition. Following that is what type of patient safety event is being reported. However, if you select healthcare professional for who reported the event or unsafe condition, as shown in the bottom panel here. Then another question will appear asking you what is the type of healthcare professional. This type of guiding question will occur throughout the form, making sure that you are only asked to answer questions that are pertinent to the situation that you're reporting. When you're entering data in the safety event forms, you'll have two types of check boxes. In this case, you have a radio button when you can only select one answer. There are several questions that present you a square checkbox. That indicates that you can select all of the selections that apply. If you are required to select an organization and location while you're filling out the safety event form, then select the link for select location. When you do, a pop-up box will present to you that asks you to select a location. Simply select it from the pull-down list. Once you select that, then a list of locations within that organization will be populated, and you can select the appropriate location. Once you have finished, select the select button. When you're ready to save your form, at the top or the bottom of the form, you have a menu that says Cancel, Save Form, and Add New. If you select Save Form, then once you have completely filled out the entire form, then that form will be closed and that record will be sent, that safety event will be sent to the reviewing manager. If for some reason you need to enter multiple safety events, select the Save Form and Add New. When you do that, it will give you a fresh, empty patient event for you to fill out. And you don't have to keep going back to Epic and coming back in for each one of these events that you fill out. You just continue to select Save Form and Add New, and it will continue to allow you to report for that particular patient related to that Epic record. It will allow you to continue to report, record safety events. So if you have 2 or 3, that's the easiest way to do that. If you missed one of the required fields, you'll have a pop-up that will show you what you have missed. So in this case, a selection is required for each of these 3 questions. When you're using Oscar, if there are places that you need help, there's 3 ways to get help. Number 1, you can search for Oscar in HealthStream, and you will have a list of tip sheets and recording of Oscar training. If you're filling out a patient event form and you have a question on how to answer a question that's presented, then the first place to look is to contact your managers or team leads. Or you could contact your facility risk managers or contact corporate risk management. If while you're using or trying to access Oscar, you get an error message, maybe when you try to access it out of Epic, you get an error message instead of getting to Oscar, or within Epic, or once you get in Oscar, if you get some kind of an error message, then we ask you to call the help desk. You can reach the help desk at 901-227-7777, toll free at 888-838-3777, or you can email the help desk at helpdesk@bmhcc.org.